dengar aku tak?
Dengar? Dengar apa? Kejap. Ni pakai kau adik aku. Macam mana aku nak masuk? Adik aku nak masuk nanti.
Boy, busy betul Aina.
Aku add adik aku tau. Lepas tu kan, nanti kalau adik aku nak masuk online class, macam mana nak masuk kan?
Dia ada online class ke sekejap lagi?
Ada pukul 8 sampai pukul 10. Lepas tu, masuk aku.
Lepas tu?
Aku daripada hari tu aku tak boleh masuk.
Oh my god. Lepas tu macam mana?
Tu dah, macam ni lah.
Aku pun tak tahu lah. Aku tak pernah pakai phone lain tak. Hai Hasif, dah sampai rumah ke?
I'm on it. Go ahead.
Allah.
Mak, mana?
Dengar ke?
Dengar. Orang Korang tak lemam ke petang ni?
Hello. Hello, Azhan.
Ya.
Nak.
Apa?
Nak test jugalah. Jadi,
Jadi.
macam nak instruction. Wow, shoe ke-8.
Tak ada suara Shu.
Shoe tak ada suara.
Nampak tak muka aku? Nampak je kan?
Nampak?
Okay.
Korang aku lemah lah.
Ha? Lemau. Asal tak ada
Segar macam pagi-pagi baru bangun.
Mandi aja ni.
Baru siap mandi.
Wow.
Wow, kau tak asyik wangi.
Thank you. Good never.
Safura as usual lah busuk.
Ya, aku tak suka bang Safura.
Ulun, tajuk.
Mana Zati?
Mana PA?
Tahu.
Ada macam dekat Mahalah.
Shoe dia mana shoe?
Sudah ke-8.
Okay.
Style. Lighting shoe style.
Ada something.
Tu ke selfie ring.
Aku.
Takut gapo? Ada dia pula takut.
Aku tak boleh follow.
Baca PM shoe.
PM. Oh PM. Ada PM ke?
PM dekat Zoom.
Maksudnya boleh PM.
Boleh hantar mesej tapi orang lain tak boleh baca pun.
Oh yeah. Okay.
Tukar everyone tu.
In case macam duk senyap lagi. Macam bila idea tanya sistem kau ni kau gitu.
Oh faham. Weh, semua ambil air semayang dah ke?
Dah?
No.
Masih pun. Asyik duduk dalam masjid dah ke?
Apa masjid?
Gereja ke tak sih?
Sedih lah nampak korang sebelah je.
Sebelah.
Rasa cacat.
Mana ni?
Gana nak tukar background?
Oh lah guna phone.
Oh kena.
Guna
Sekejap je. Adalah dekat start video tu ada tulis choose version background kan.
Start video. Start video. Okay.
Lepas
batu buat Gana nak pilih?
Pilihlah gambar. Tekan choose version background.
Boleh search kau?
Lepas tu dekat tambah tu add image.
Okay.
Cuba buat.
Oh ni daripada komputer kita sendiri.
Ha,
Kalau hard disk dia ada tak ada?
tak ada.
Sekejap nak try. Tahu laptop ni detect ke tak?
Saja tak ada.
Takutnya background.
Jadi kan? Oh,
Siapa lagi?
buat apa semula tu ya?
Tak jadi pun. Oh, solid
cuba
colour
tengok.
kena duduk kat ni. Dinding hak.
Oh, iya ke?
Dinding hak warna dia macam plain gitu.
Oh.
Tu kan ada gitu. Okay.
Oh.
Mana dinding? Jepang dah. Tak.
Sini buat juga.
Ada gambar lah ni. Tiba-tiba gambar sendiri.
Background gambar ni, gambar TA.
Boleh lah. Nak alih nota apa?
Doktor kena remind ke? Tak payah.
Maghrib kau apa?
Depends.
Oh.
Depends.
7:23.
Oh, Azhar dekat Padang Pasir.
Asal kena pakai ni. Untuk apa?
Sebab. Sebab.
Unta mana unta?
Unta. Ni unta? Ni unta.
Siapa ambil tak?
Background lain udah kan. Nak lecture hall ni.
Buat gambar lecture hall.
Masuk lah.
Allah, kenapa katil?
Tak ada lagi.
Milik Kobe.
Tak kubel. Biasa je.
Biasa
Yang
je.
skrin yang
Tak lagi
besar
siapa
ni.
Azhar.
Macam mana dia boleh tukar-tukar?
Apa dia?
Skrin yang besar ni.
Oh, sebab awak buat siapa yang bercakap, speaker view. Kalau awak buat
Oh, ni buat yang semua tu.
Ya,
Kat
iyalah
mana?
Safura tu.
diamlah.
So sweet.
Dekat
Kalau buat
mana?
gallery view, atas, belah kanan, sebelah participant. Kanan skrin kita, kena tulis.
Oh, gallery view.
Gallery view.
Lepas tu nampak semua orang.
Allah, sure.
Tak tahu.
Kenapa
Syumur duduk mana tu? Muka ni solek ke apa tu?
Oh dah.
Syum macam nak buat Syum macam nak buat mukbang.
Tu lah. Acak lah Safura.
Boleh je nak buat?
Lighting show.
Mukbang yang shaded tu.
Wow.
Buat mukbang sekarang.
Sikit.
Oh, dan
Hasil planet mana? Oh, Hasil. Datang dari
Azhar
kegelapan.
duduk IMC ke tu?
Rindu tak?
Weh Azhar, maksud dua tengah panas ke?
Duduk kat tempat parking ni.
Standby dekat sejik.
Tak buka lagi pun. Kita.
Tak apa ni? Nah, ni lah.
Wawa.
Tak. Anak buah I.
Madu.
Anak buah ke anak?
Anak.
Anak asing kan?
Anak freak.
Oh, dia Kelantan tu.
Asyik agak apa sih? Oh, Dr Mossad.
Sekejap, doktor ni mana?
Orang lapar.
Dr Maya dulu oh.
Haji. Sekejap, doktor Muslim kan?
Ya.
Serius?
Ya bisa ada umur kan lah.
Tahu.
Doktor kat dalam NICU lagi kot.
Prof How je, non Muslim je.
Dia Azan panggil dekat MNC.
Itu dah lah lain-lain masa waktu.
Lain pula.
Pilih Sephora.
Diam lah.
Ambil solat tak Mas?
Solat, Alhamdulillah.
Bukanlah kamera.
Kamera. Tak boleh. Sekejap boleh?
Sebab wow.
Sekejap, I have to change my...
Nak juga.
Lakalah dia.
Meniru.
Niru Amir.
Amir kena colek ke?
Tak kena ada lampu.
Siapa nak culik Ami?
Kan?
Tak berbaloi.
Ramai lah.
Menyusahkan.
Pasif kot
Boy,
ni.
gelak.
Oh,
Pasal
Azan
sangat
kat
tu.
kampung wayang ke tu?
Bukan jerit.
Nak ambil. Tiba.
Amazing. Perfect.
Sure. Tak betul kamu tak kena solat tu. Kalau tak kita orang boleh selamatkan kau sure. Walaupun kita orang tak nak tapi
Keluar efek kau ni juga kau benar tak?
Dah. Bilik tu lampu.
Oh.
Oh, tak ada pasal lampu kat atas.
sekejap kalau aku tutup lampu.
Time.
Amir nampak macam penjenayah.
Amir dekat bilik merah.
Jenayah apa?
Asif, kenapa you ada 2 account?
Oh, satu dekat laptop.
Satu akaun ni fandom. Bah.
Ada.
Sure. Apa belakang kamu tu?
Wawa kat Penang kata Wawa.
Kat Penang ni.
Amir.
Dia apa?
Atau bagi.
Saya kot main kau ni.
Bodoh lah. Nanti nak hafal skrip.
Orang ingat kan jauh. Ingat
Amir.
jauh sikit
Amir nanti buat lagi tau Amir daripada doktor.
Aku buat macam ni.
Nak jumpa Pacu? Come. Come lah.
Doktor Amir.
Azan kau record kan sebenarnya?
Tak, doktor dah ada.
Doktor dah ada.
Okay.
Assalamualaikum.
Waalaikumsalam.
Salam.
How are you?
Alhamdulillah.
Sorry,
Alhamdulillah. It's okay, doctor.
it's very busy. Let us start as I think we need to get an break at 8 to pray Maghrib and then continue inshallah. So
Alright.
just someone alert us if it came to 8. Allah. Let us start by Al-Kitab. today we have two long case. I hope we will follow the same scenario before. So we are working here clinical, inshallah. Hoping soon you will go to the hospital and you will apply all this, inshallah, soon. Who's our first presenter?
Me.
You are welcome, Shuhada. And
Yes.
you are role player or?
Role play.
Okay, role playing. Okay.
Okay.
And who is?
Me,
Who?
Azhan.
Azhan. Okay, so we have Shuhada and Azhan today. Okay. Go ahead. You have 20 to 25 minutes, regulated by someone of you, please. And after that, we will continue, inshallah. Everyone switch off the mic, please.
Okay, Azhan.
Okay. Madam Shahada, can I know why you come here today?
Oh, actually, my son was referred from Klinik Kesihatan Bandar Baru Pekan to HTAA. Due to doctor said his blood pressure is high.
Oh, how old is your son?
My son, Hakimi, he is 4 years and 9 months old.
Was referred from Pekan
Yes, Klinik Kesihatan Pekan.
due to a routine appointment, or do you have any other occasion?
Oh, actually, early this morning, we had a follow-up to monitor his blood pressure. And then doctor said the blood pressure is high, so that's why he need to refer to HTAA. And for the past 1 month, Hakimi had follow-up weekly for his blood pressure monitoring.
May I know why do he has to go for follow-up for the blood pressure weekly?
Actually, last month he was admitted to HTAA because he had episode of loss of consciousness and seizure. So after that, he had to follow up.
Can you describe more about the loss of consciousness that happened? I mean, is it sudden in onset? Were you there when he lost his consciousness?
I was not there and I can't really remember the episode.
Oh,
But
have
doctor
you-
said it's kind of a bacteria infection that affect his kidney and cause hypertension and affect his brain. Doctor said something like that. And he had to monitor his blood pressure.
Can I know whether your child has this kind of history before, the loss of the consciousness and seizure, or is it the first time occur for the past 1 month?
It was the first time.
So that was the first time lah.
Yes.
And so after the incidents occur, you went directly to meet the doctor. I'm lost. You said about the infection of the kidney. Is there any thing that you notice a difference during the urination of your child? I mean, is there any presence of blood, or did he complain any pain during urination?
No. There is no symptom of urination problems.
No complaint of pain, any
No.
nocturia?
No,
So
just loss
everything
of
is fine.
consciousness. Yes.
Also no blood in the urine?
No.
About the loss of consciousness, do you know how long does it occur? Is it like for a few minutes or almost half day or?
Sorry, I can't remember the event.
Um, do you remember, does your child have fever or not?
No, there is no, recently there is no history of fever. Okay.
No fever. After the occurrence of the seizure, what happened to your child?
He got seizure and lost conscious. That's all I can remember. And then warded to HTA for 10 days.
What was prescribed for him?
He was prescribed with, the drug name is nifedipine. Nifedipine 5 mg twice daily.
Does the doctor, I mean, 1 month ago, when the loss of consciousness occur, does the doctor say something about his blood pressure? Is it normal?
I don't know about the past 1 month, but he said that my child had to follow up weekly, just that. Just that.
About the medication, do you compliance with the medication?
Yes, he is
many
complying
times-
to medication
How many times take per day?
twice per day.
Twice per day.
Yes.
Is there any similar symptoms occurs after taking the drugs?
No. There's
So
no.
the seizure doesn't reoccur.
No.
Do you notice any swelling of the limbs?
No, there is no swelling.
Does your child complain any abdominal pain?
No, there is no abdominal pain.
No abdominal pain at all. Is there any history of trauma happen?
No.
Okay. I would like to ask does your child complain any loss of appetite?
No.
Lethargy?
No.
Do you notice any exercise intolerance like easily getting tired, shortness of breath,
No.
or sweating easily?
No.
Was there hemoptysis?
What is that?
I mean, the bleeding. Hemoptysis. Bleeding.
Blood is splatter. Vomit blood.
Vomiting blood.
No.
No. Is there any vomiting happen?
No.
Do you notice any tachycardia?
What is that?
Do you notice any the fast breathing, rapid breathing, or any difficulty in breathing?
No.
No. No, that's really do you notice any rashes on the skin of a child?
Yes, there is multiple brownish scalps
Brownish
on the scalps.
scalps?
Kudis.
Oh,
On the lower limb and trunk. I think it's because of that bacteria infection before.
Do you remember the name of the diagnosis that was given before?
I jot it down. So, okay, wait a minute. Doctor said it's PRES. It's posterior reversible encephalopathy syndrome. Last month.
Does your child complain any neck stiffness?
No.
Do you notice any abnormal movement or tremor happens?
No.
No. Is there any change of bowel habit recently?
No.
Any change of vision and hearing?
No.
Does your son complain any having pain at the joints?
No.
Also no.
Yeah. I think I'm good. No.
Is there anything that from your own perspective, what do you think is happening, is causing the child to have high blood pressure? Is it from the same disease as before? Or is it
I
coming from other source?
what I think is my child is doctor said he is obese. So maybe because of obesity, so his blood pressure is kind of high. Mm.
Can I know about the hospitalization of your child?
This is the third time he is hospitalized. So the first time is 1 month ago due to the seizure and loss of consciousness as I mentioned before. And the second time just to review his general condition. And this is the third time.
Oh, you mean you just had third appointment lah for that second appointment?
I'm not sure about maybe yes.
The second visit, what was the blood pressure? Was it normal?
I'm not remember, but the blood pressure that early this morning, that one is 100 to 100 to 132 over 51 to 88 this morning.
Was your son had admitted before due to other reasons?
No, just
No.
because of this condition.
Oh, okay. Apart from nifedipine, does your son takes any other drug?
No, only this drug, and he is compliant to the medication.
Do your son has diagnosed any other disease apart from the disease that he had 1 month ago?
No.
Any underlying disease? No.
But he is obese. Yeah.
Just obese. He had no diabetes mellitus.
No.
Does your son has any drug allergy or food allergy?
No.
No
As far
allergies.
as I know, no. There's no allergy.
Uh,
Food
ca-
also no allergy.
oh, okay. Can you tell me about the birth history of your son? How was the delivery?
He was born through lower cesarean section.
Uh, can I know why?
Doctor said it's due to premature contraction and high blood pressure.
Was there any complication of that delivery?
Actually, he was born at 32 weeks, and his weight was cut quite low, which is 1.95 kg. So he had to admitted to an ICU for monitoring for 1 week, and he also had neonatal jaundice for 3 days and undergo phototherapy. Do you get me?
Yeah.
Okay. And during the pregnancy, I was diagnosed with diabetes mellitus and hypertension in pregnancy.
Okay. About the neonatal jaundice, how many days was he warded?
3 days.
3 days only. What do you think about his developmental history? Do you think
Everything was just fine. He is fine, yeah.
according to his age lah?
According to his age.
Can I know who take care of him?
Me myself.
So
I'm
you're
a housewife.
housewife lah.
Housewife.
Can you tell me about the about his can I know for how long you breastfed your child?
I breastfed him for 3 months, and then he continued bottle feeding until 3 years old. And currently he practicing just normal adult diet.
Until 3 years old?
Yes. Until 3 years old for bottle feeding.
Two.
3.
3.
Breastfeed until 3 months.
Oh, can I know why you stopped breastfeed until 3 months?
I can't remember. I think I can't remember.
Does he have any problem with the bottle feeding?
No.
No problem.
Yes.
What about his immunization and drug history?
He is on immunization as follows.
Complete.
Yeah.
Okay. Any extra vaccination taken?
No.
Was there any side effect after taking vaccinations?
No.
No. Can you tell me a little bit about your family? How many children do you have?
I have 2 sons. He is the second one. The first one is 9 years old, and he is in primary school. And my husband is 56 years old.
56?
Yes. And I am 29.
Oh, 29.
Do I look young?
Oh yes, you look so young. Can I know about the history of both you and your husband? Is there any disease that you guys have? Chronic diseases?
We both have diabetes mellitus.
Diabetes mellitus.
But I can't remember since when.
Oh, so you were telling me about that you had diabetes mellitus and also hypertension during your pregnancy. Is it only during pregnancy or you still have it?
Diabetes mellitus, I still have it.
Okay,
But
but hypertension during pregnancy.
ah,
Okay. About your son, 9 years old, is there any? Is he okay?
he had weight problem before.
With problem? Can I
Yeah.
know why?
I'm not sure.
What do you mean by weight problem? Is it excessive overweight or underweight?
Underweight.
Underweight.
Sorry, I can't remember.
Okay.
I think he's during underweight.
Underweight.
Go away.
Madam, where do you live with your family?
I live in Pekan.
Pekan. Can I know what kind of house that you live?
Single story house.
Single story.
Uh,
With 4 occupants lah.
yes, adequate facility. And just with my family.
You are a housewife. Your husband works as?
He is a security guard.
Security guard. Can I know the nearest clinic?
Klinik Kesihatan Bandar Baru Pekan.
How far from your home?
10 minutes.
10 minutes only. Oh, okay. Itu je lah kan?
Siapa yang time masa?
Just now you had mentioned about the brain infection.
1 minute.
1 minute. Just now you had mentioned about the brain, something about the brain and also the infection of the kidney. Can you tell me more about the brain? What happened to the brain of your child?
I don't know, but doctor said it because of the complication from the kidney itself that lead to brain increase in blood pressure in brain.
So basically, the problem is coming from the kidney and the complication will affect the brain. And they presented as the loss of consciousness and also seizure.
Yes.
Oh.
That's what I understand.
Can I know what tests were done to diagnose the disease?
I'm sorry, I'm not remember.
Okay.
Thank you. Inshallah, good job. She is making a very good role player, and also you are a good absorbent. Can you make summary for us, please? Thank you, Shuhada. Thank you, Azhan. Can you tell me now a summary, because summary in our practice is very important. How to do summary? You must train many times. So during your endorsement to other, after you have a duty like that, you can give all the important knowledge in a concise time. So tell us from the history in just 2 or 3 sentences.
Okay. Hakimi, a 4-year-old Malay boy, was referred from Clinic Pekan due to uncontrolled blood pressure during his routine appointment for his disease. With underlying obesity. Okay, the child complained of having there was no complaint. The child had increased uncontrolled blood pressure. However, there was no complaint of dysuria, increased frequency of urination. There was also no nocturia and no hematuria. And the child doesn't have any abdominal pain and any history of trauma recently.
Okay, what did the mother tell you about the diagnosis?
The recent diagnosis.
Yes.
About the press.
No, you tell her what is the diagnosis by doctor. She told you, is it ES? What is the diagnosis? Show her that again.
About the
diagnosis.
reversible
Encephalopathy syndrome.
hypertensive encephalopathy, secondary most probably to
what?
Post-streptococcal glomerulonephritis.
Streptococcal glomerulonephritis. Okay, so what can be your diagnosis, Azhan?
I think the diagnosis maybe is the unresolved disease that he had 1 month before.
Sorry?
I think the diagnosis is hypertensive.
Okay.
Hypertensive and secondary to acute glomerulonephritis.
Okay.
Post-streptococcal glomerulonephritis.
So usually if we, in our practice also, I need you to take care. We are not accepting one diagnosis. Usually you must put what is the differential diagnosis anytime. Because many times you will find the second or the third diagnosis came to your mind is the correct one. So what is the differential diagnosis? If we accept that this child has hypertension and has got reaction in the brain known as hypertensive encephalopathy. What can be other causes?
It can be from the primary hypertension itself because the child is obese.
Okay. So can be secondary to morbid obesity. Okay.
And also secondary to any endocrine disorders such as adrenal disorders or also thyroid.
Very good. So we must suspect endocrinal disorders because the child is just 4 years. Remember that now from year 4 or year 3, it is better to start the blood pressure for any patient, any pediatric patient came to you. Because they found many cases can be picked with essential hypertension, okay? So you said it can be heart failure secondary, so hypertensive encephalopathy secondary to glomerulonephritis, secondary to obesity, secondary to endocrinal disorders. What else can cause encephalopathy? General. You must think general in the symptom in front of you, then you will not miss an important differential diagnosis.
Nephritis?
Okay, we said glomerulonephritis is nephritis. It is the same like Azhan or Dr. Azhan, it is the same. Let me make it more simple with you. Now we have a patient with hypertension, okay, and encephalopathy.
Renal arthritis.
If this patient has a problem inside the brain and it causes increased intracranial pressure, what is the triad of increased intracranial pressure? You are fresh now for your basic science. What is the triad? And what is the name of this triad? triad of increased intracranial pressure. Anyone can.
Cushing triad.
Sorry.
Cushing triad.
Yes.
Hypertension.
Yes.
Bradycardia, and also irregular respiration.
So we must suspect any lesion in the brain itself, and cause like space occupying, like increased intracranial pressure, like even sometimes meningitis or meningoencephalitis can be presented by all that. Okay. So it is very important just to think broad on the symptom of the patient. And this is a good chance for us really. I used to advise my student to take care about that. Think about before go deep for other details, what is the probability? Because sometimes the patient may get more than pathology. So what investigation you will consider now, Azhan?
I would like to do full blood count to check any signs of anemia or infection. And then I would like to do a urinalysis to check for the nitrite and also leukocyte. And also I want to check for any red blood cell, any proteinuria, presence of protein in the urine. And then for his previous disease, I would like to do ASOT, antiseptolysin titer. And then I would like to do throat or skin swab. And I would like to do complement C3 and C4. And then I would like to proceed with imaging. I want to do ultrasound of the kidney, ureter, and also bladder to check for echo density and also the dilatation of the URT to rule out any obstructive uropathy.
Okay, what else?
I want to do renal profile to check for acute kidney injury, the evidence of acute kidney injury if there is any. And also to check for electrolyte imbalance.
Okay. Okay, again,
and then
yes.
I would like to do the CT brain to exclude any hemorrhage or ischemic causes.
Okay. Good. So another memorize for you, try to divide the investigation into 4 categories. Number 1 is the lab. And please, if the representative of the group can ask for doing some, how to read the full blood count, because this is simple and most commonly requested, and most of the time we are not making a benefit of it. Okay, how to read the full blood count, how to read the blood film. Okay, it is very important how to comment for a common radiological problem like chest X-ray, how to comment for it. It is very important. Please, if you can go through the most common investigation and divide between you, you have a good number. At the end, you will find it very simple for all of you. If everyone did a part and put it in the group, and let me see it, it will be very beneficial, inshallah. So number 1 is the lab. Lab, as you told, can be like full blood count, okay, for anemia, for infection, for platelet abnormalities like that. And then if you are thinking about infection causes, you are going to consider the CRP, you are consider procalcitonin, you are consider specific like blood culture or some organism if you suspected like ASOT, all this. And you can consider also like C3 and C4. I will put C3 and C4 for the next one, okay? But for any hypertension, you must start by BUSE, BUS, blood urea serum electrolyte. Because it may be you just pick that the patient has renal failure or renal impairment or acute kidney injury. You may find there has some abnormalities, okay, in the electrolyte, especially potassium and sodium, okay. You must add at this time the blood gas. With blood gas with some electrolyte disturbance with hypertension, I think you will go through internal medicine or not yet?
Ready. Yes, Doctor.
Already.
Okay. So you must be able to, if any patient got hypertension, you must go for hypokalemia or not. And what about the blood gas? Is it metabolic alkalosis or not? So you are going for mini syndrome there, if you can remember. Okay, Bartar and Pseudobartar and Gitelman and all of this is very important. Okay, so this is the first one, lab. You will add also urine, okay, for RBC test, for infection, for hematuria, okay, for hemoglobinuria, for protein. All this is very important. Then there is radiology. You must think, does this patient need radiological investigation? Okay, it may be the patient has a problem with the kidney, may have a problem with the heart. Don't forget that sometimes the hypertension is secondary to cardiac issue also. So sometimes you need to check if there are any cardiomegaly, if there are any abnormalities. It may be in the brain. Okay, sometimes you need even to do for pituitary to rule out anything. So we have lab, we have RADs, we have also bedside tests. Okay, in every situation, you must remember what is the bedside test I can do. Maybe this example is not the frank one, but we used it to say if the patient has convulsion, what is the bedside test? Very important. Baby came to you and tonic clonic convulsion, generalized one. Yeah, glucose, dextrose, because hypoglycemia in children can cause even status epilepticus. So any child came to you, just prick and got 1 drop of blood and see he has got hypoglycemia or not, because it is very easy to treat. And if you miss, your treatment will not be able to give a good result like dextrose. Okay, so it is very important. If you go to one patient with asthma, what is the important bedside test you need to do?
Pulse oximetry.
Severe, yeah, pulse oximetry, or severe respiratory distress or asthma. You have pulse oximeter, you have
Spirometer. Spirometry.
Spirometry.
BEFR, very good. And you have also blood gas.
Blood gas.
Why? To see if there is any
Acidosis.
organ failure or not, respiratory failure. That is to say, every disease, if you try to ask yourself these two questions, is there any bedside test it can guide me? Because in emergency, you mustn't wait until you call the radiology or call the lab and go the test. Sometimes there is a bedside test. The last one is the specific test. Now you think it is glomerulonephritis, so you must ask yourself again. Because in every time you meet the patient, if you forgot this test, you are wasting time. Because you will not come to the conclusion without it. Like if this patient, I suspect now he has glomerulonephritis alone. So I will ask as as Han said, I will ask for C3, C4 because it is very specific. What did you suspect, Azhan? For C3 and C4? So it will be C4 normal, but C3 is low. If I suspect this patient has SLE, can be. But what is the specific for SLE?
Anti-nuclear antibody.
Double stranded DNA.
Double stranded.
Okay. It's very important. If I suspect it is post-streptococcal, so I will ask for, besides C3 and C4, I will ask for ASOT, or the more specific is anti
DNA,
yes. NA now is very specific, but it depends, is it available or not? Okay. If I suspect it is IgA nephropathy, I need to go for another immunoglobulins. Okay. If I suspect that is why every disease has its own specific test must be done. You cannot forget it. If you forgot, you must do, and then you are wasting time to able to sit by chart this diagnosis is like that. Otherwise, most probably the diagnosis is like that. I would like to confirm by the test. Forget that in examiner you make like that, but in every patient, if you did like that, it is very bad. Of course, wasting time, delayed coming to your diagnosis. So investigation are divided into many categories. Now, who will present the OSCE?
Me for
You are welcome.
OSCE 1.
City Adawiyah. Oh,
Yes.
inshallah. Okay.
Okay, for first OSCE, we will going to do regarding nephrology. For first question,
You can go to the second. Yes. Good.
For first question, a 6-year-old boy was presented with puffiness of the face for 3 days. A week before, he had been treated for throat infection and was given penicillin. For A, what is the diagnosis for the above statement?
So who can answer? I need someone to raise his hand to answer. What is the most possible diagnosis? Okay.
Acute post-streptococcal glomerular nephritis.
Okay, so who can describe what is apparent in the picture? So as Han said, it can be post-streptococcal glomerulonephritis.
Periorbital edema.
Okay, so who will answer? Is it periorbital edema is specific for post-streptococcal, or what is the differential diagnosis of periorbital edema?
Nephrotic syndrome.
Nephrotic syndrome.
No, I need to go out of you, of both of you. Let us chair, please. Let the others.
Nephrotic syndrome?
No, other candidates.
Oh.
Who will answer what is the differential diagnosis of puffiness and edema? I will choose.
Can be also due to chronic kidney disease.
Okay, so kidney disease. Okay. Who else? No. Amir, if you see a patient with puffiness.
I answered nephrotic syndrome just now.
Yes, nephrotic and acute kidney disease. So Fatiha, what can be the other differential diagnosis?
Heart.
Very good. Heart. What type of heart disease can cause?
Failure.
Heart failure.
Heart failure. Very good. Thank you.
Congestive.
One Hasif. What can be other causes? Asif? Asif Wan Hassan?
Yes, sir.
Tell us. Now they said it can be kidney, it can be heart. Any other diagnosis must be considered? What other important organ can get failure?
Liver failure.
Liver failure.
Failure.
Yes. It is very, very important. What else can cause this generalized edema by Nagwa now, if she can answer?
Cushing disease?
Sorry?
Cushing disease.
Very good. So it is protein caloric malnutrition. Okay, very good. Any other diagnosis we must consider also, like allergic, like autoimmune.
Inflammation.
Yes, autoimmune inflammation. That's why any disease, if we are very meticulous and they came to the first and the second year of basic, if we come back to it, it will be very informative. What is the type of pathology? It is either inflammatory, it is either malignancy, it is like that. The causes of pathology which you got it, and most of you feel it may be burden, but really it is very beneficial. So, what is the three cardinal feature of post-streptococcal? Who can answer, or should I choose?
Protein. Can I answer?
Yes, please.
Proteinuria, hematuria, and also urinary cast.
Sorry, is it proteinuria is a fixed part of the glomerulonephritis?
Hypertension, yeah, edema.
Yes, hypertension. Yes.
Hypertension.
Edema and hematuria.
Yes. So, what is the color of the urine here?
Dark
brown.
Dark
Sorry?
brown.
Reddish brown.
Oh, is that it? So why if it is dark brown, why you said it is hematuria? Usually we need to say blood. Usually you said it is cola-like or tea color, not red. So it is not frank hemorrhage. Yeah, just I will ask another question. If you have someone who has GIT bleeding, you are dividing it into upper and
lower.
What will happen for the upper?
Black tarry stone.
Yes, so it will turn to melena. It is the same.
Melina.
Yes, now the RBCs came from up. It will be distracted, and there is hemoglobin inside it, which gives this color. It is not frank. If you find one patient with frank blood, usually it is not the
lower tract.
Yeah, even if it is upper but very massive and doing like that, you are going to suspect malignancy, stone, severe infection like that. Okay, so this is the importance of the color. The last question, what are a?
This question is similar to what you had said before actually.
Okay.
What is the investigation of that you want to do to detect the etiology of the disease?
Okay, so now you can tell us again what is the diagnosis. You are the one who prepared.
Prognosis is post-streptococcal glomerulonephritis.
But take care that the patient has sore throat, yes? But the most common to cause the kidney problem is the skin, is the impetigo. Remember that streptococcal, if came from the skin or came from the throat, can infect heart or kidney. Okay? But the most common for the kidney to come from the skin, and for the heart it will come from the throat, but still can be. So remember that. So you must, at this situation, check the skin. If the patient has like impetigo, like infection, like that, scabies, infected scabies, all this can be a clue for that. The second part, what is the three cardinal features?
The first one is edema.
Okay.
Second one is hematuria.
Yes.
The third one is uremia.
Yes. But the most important also is the hypertension.
Hypertension and oliguria.
Yes. The many cases will be presented by hypertensive encephalopathy, and it will be presented by thickening. So many cases just came to the emergency. This child has fit, and we run to see, and then we come to the diagnosis of post-streptococcal or whatever glomerulonephritis. Okay. Any other slides?
This one.
Okay.
According to the lab result above, what is presented with fatty urine? What is the diagnosis?
Okay.
Can you someone please state what is the abnormal in the result?
The total bilirubin is low, as well as the total protein. The albumin is low, and the alkaline phosphatase as well as ALT and alkaline phosphatase is low. Then the protein is high. And there is erythrocytes in the urine. High number of erythrocytes.
So what do you think is the diagnosis for the patient?
Acute kidney injury.
Why?
Other than AKI?
AGN, acute glomerulonephritis.
Complication.
Any other answer? We have 2 minutes to pray al-Maghrib. So you must read an important table about how we differentiate between nephrotic and the nephritic. Okay? And there is sometimes you will find yourself in the middle of both tables. So sometimes there is looks like nephrotic is a mixed. Because here we have also some criteria for the albumin is very low and it is present in urine also. The protein is very high. Okay. To say nephrotic, we need another criteria, which is
protein.
Yes.
Lipid.
Cholesterol. It will help. So, can you comment the presenter upon your slides?
Actually, I want to. This is the result for the nephrotic syndrome patient.
Oh, but don't forget that you add RBCs also. So that's why I think it can be mixed picture or nephrotic. Sometimes it can occur. And one of the parameter of the criteria of severe nephrotic is the persistent hypertension. And the criteria of bad glomerulonephritis is that it have nephrotic-like presentation. Okay? Who can say what is the complication of post-streptococcal?
Hypertensive encephalopathy.
Okay, don't repeat yourself. Any other? You must
pulmonary edema.
Yes, so, okay. What else?
Nephrotic syndrome itself.
No, you must think any disease with the kidney can lead to kidney failure, acute kidney injury or chronic kidney injury, because it is about 2% can end by. So this is the issue. How do counseling for the family? Because some of us are not so clever to give the message in the correct way. If you read the book, the prognosis is very good. Most of the patients will improve, but they will get some hematuria, microscopic one, for about 1 year. Blood pressure will be settled within 1 month or 6 weeks, like that. But the patient needs follow-up for 1 year. So it may be Azhan, go and read these few sentences on the most important book like Nelson or one for specialty, and they tell the family that. Sometimes the family feel very safe, don't worry, they will not come back. It happened with me. I just called one patient because after the discharge, he missed. And when he came back, still hypertensive. That's why, please, be safe, doctor. Be honest, be clear. Don't over assure or make them upset. So you must be frank, honest, clear, and sympathize with the patient. This case we used to get a good result, but really we are a bit afraid it can affect the kidney. It may be blood pressure stay high for a long time. Also, the blood will still come from the kidney for a long time, which you cannot see by your eyes. So we need to make sure it is improved or not. So it will be, you will be engaged with us for about 1 year for monitoring of your son. I will give you appointment regularly to see him. We need to repeat the blood, we need to repeat the urine, like that. We measure the blood pressure, which is very important because sometimes the pressure can affect many organs. So that is the issue. In spite a good prognosis, your child must be followed strictly. Otherwise, he can get some complication for his kidney or his brain or other organ. Okay, that is the issue. So if you are good in counseling, inshallah, you will be good for everything. Thank you. Let us pray Maghrib and we can start inshallah after about 10 to 15 minutes. Okay.
Okay, doktor.
Assalamualaikum.
Waalaikumsalam. Gelap kan? Kuat ke?
Tadi cerah sikit.
I'm back.
Korang macam tak oski tadi ke macam apa-apa je?
Bawah.
Apa?
Okey tak tu. Tengah macam muka
Tak siap.
sedih je. Zati.
Korang dengar, korang nampak ke tadi?
Tak. Nampak apa?
Apa yang aku tag lah.
Yang kau buat nangis tu Aku macam Zati, doktor boleh baca kot.
Zati dia tak boleh cover gelap sampai dia keluar. Dia tutup kamera dia.
Ya weh,
Weh.
aku tak tahu.
Lagi nak tengok Zati pula.
Zati susah.
Ya
Kes
ke,
kau
eh?
pasal
Oh,
apa Zati? Dah.
Berarti aku macam tahu je.
Aina.
Macam tak apa hati aku. Aku rasa dia kalau hati orang.
Kes berkait dengan Down syndrome. Neurologi.
Ya, aku takut aku punya history merepek tu.
Patient tu,
Doktor Surai.
patient tu hypo kan.
Kalau kau tak tahu cakap, I don't remember.
Dah masuk dah.
Sebab tak boleh reka.
Zati. Relax.
Takut.
Tapi kalau aku macam tu.
Habis Laina.
Syu.
Hmm?
Syu.
Kau dia.
Yang kau bagi jawapan tu semua jawapan doktor ke?
Yang aku tak tahu tu tak ada dalam history lah. Kau tak aku tahu. Takkan aku nak reka.
Ya, nifedipine 5 mg.
Yang tu ada dalam history lah. Oh.
Weh, aku tak tahu budak ni ambil ubat apa.
Dia lawak, dia tengok nama ubat dekat tu.
Kejap
Ingat nak tengok kertas tu, rupanya dia bagi buka ubat tu.
Syu, yang post
Aku cakap
encephalopathy syndrome tu betul?
Ada dalam history.
Oh.
Sebab tu dia tak boleh cakap loss of consciousness tu macam mana. Sebab dalam
sebab
tu dia
dia
tulis macam tu.
tak bagi detail.
Doktor.
Doktor ada sebut 8.50 ke tadi?
tak tahu.
Tak ada.
8.50?
Tak buat.
Ke 10 sampai 15 minit je break.
Oh.
8.50 aku caw luar.
Masalahnya orang bawa laptop pergi Penang tapi tak bawa charger. Sekarang ni 27% je. Lantak
Ya.
alamat jadi. Dengan kelas
Habis
aktivis
dah
lagi.
Bila
Minggu
balik?
ni, tak tahu.
Kelas aku.
Tak. Minggu
Jumaat.
ni ada kelas lagi.
Oh, wow.
Jumaat.
Hari Khamis.
Khamis.
Seminar.
Khamis. Oh, 3 lah kan, lagi 2 Jumaat dengan Khamis.
Jumaat tu misalnya.
Misalnya.
I'm dead.
Down syndrome ni kegemaran doktor.
Oh my god.
Aku takut gila sekarang ni.
Tak kaya.
Boleh tak aku cakap aku workaholic?
Tak boleh.
Tak tahu sangat.
Tak boleh.
Aku letak anak aku dekat rumah kakak aku. So I don't know much.
Oh my
Boleh lah. Weh, kesian lah Aina kalau macam tu.
Neglected child.
Cakap je.
Tapi kan korang ini tak masuk dalam logbook kan?
Tak apa. Assessment kita macam mana? Tak ada tak ada assessment.
Azhan.
Kita exam je kan?
Exam je lah, tak ada apa-apa assessment.
IM ada kan IM?
Apa dia?
Assessment kita ni je kot, CWU je kot.
Ha? Hantar juga ke?
Bila kita hantar weh?
Masalahnya aku tak ada passion pun sekarang ni.
Sure.
Aku ambil. Aku ambil ni.
Ayatlah kau doktor.
Suruh doktor club patient.
Dok tahu no ya ke siapa. Boleh ke apa?
Takutnya.
Betul masuk.
Betul dah masuk.
Assalamualaikum. I hope inshallah we will finish at 9:30. Okay. So who is our second presenter?
That
Noor Al-Ain. Noor Al-Ain. Okay. Ruslan. Okay. Dr. Noor Al-Ain, what's your role today?
I will clock Izzati.
Sorry?
I will be the one who clock Izzati.
Okay. And who will be the one to be examined?
I'm the mother of the child.
Okay. Izzati?
Yes, me.
Okay. So Izzati and Noor Al-Ain. Okay. We can start now for 20 minutes. Can be?
Inshallah.
Okay. Remember that even if your long case got to 1 hour, it is for history, it is for clinical examination, it is for a lot of job. Okay. Okay, go ahead.
Okay. Assalamualaikum, Mr. Izzati. May I know why your daughter why is the reason you're coming to the hospital?
Actually, I'm concerned about my daughter because she had passed heart stool for 5 days already.
May I know how the age of your daughter?
She's 2 now.
2 years old. Okay, for passing heart stool for 5 days, you say?
Yes.
Okay. Is it sudden or you already have a history of this kind of heart passing stool before?
Actually, he already had this condition for multiple times, but this one quite long for 5 days duration.
So you're saying this is not the first time she having a heart stool? Okay.
Yes.
May I know the color of the stool?
It was blackish in color.
Blackish in color.
And
okay.
It is hard in texture.
The hard texture. So it's not watery. You kind of say hard and dry.
No. So because what I'm concerned, because he started to cry when he wanted to defecate.
Oh, okay. Is there presence of blood at the stool?
I think there's no blood.
No, no blood. Um, is your daughter complain of pain before she go to toilet?
Yes, she said that she pain,
Mm-hmm.
and I noticed like maybe so I think that maybe she pain because she wanted to pass out the stool, but she cannot.
Oh, but she cannot. At the end, she cannot pass the stool.
Mm.
Okay. Is it the pain at the area of stomach area, abdomen?
Um, I'm not sure if she has stomach ache or something.
Oh, so there is no abdominal pain at first before. Oh, there's no abdominal pain. You are saying?
Mhm.
Okay, okay. Is there any vomiting,
No,
fever?
fever, no.
No fever. Uh, does your daughter look kind of weak lately? Like fatigue, easily tired?
Oh yeah lah. I think she seems to be sleepy lately.
So she is actually less active than usual.
Hmm.
Okay, okay. Does she do you notice is she having any weight gain?
Yeah, that's one thing because she consume less, but she still gaining weight.
Sorry, I can't hear you.
She consume less, but then she gaining her weight.
I see, I see. Okay, okay. May I ask again about the passing of hard stool? Is it common for her? Okay, may I know the normal defecation time for her? Is it 1 times a day or 2 times a day? Is there any
Yes,
change in the alteration in the defecation?
yes. I before this she would defecate maybe once daily
Once
or two
daily?
times daily, but then actually she stay with my sister
Mm-hmm.
because I'm working. So and she said that for these 5 days she doesn't pass any she doesn't defecate lah.
So you notice there's bowel alteration of bowel lah. Okay. Is there any diarrhea before the constipation happened?
I think no.
No. No diarrhea. Okay.
No diarrhea.
No diarrhea. Uh, is there any you said that she lost appetite, isn't it?
Yes.
How long already occurred that loss of appetite? Is it quite long, or she already have feeding problem before this?
Since she's Down syndrome, so she actually depends on other people to feed her. But then my sister said that lately in this month, 1 month, she consumed less than usual.
Oh, so for 1 month already, okay. Oh, so you're saying your daughter have Down syndrome?
Yes, as you see right now, she has like syndromic appearance.
Oh, okay. Oh, okay, okay. I'm sorry. Um, does she can what do you say fight?
Pardon?
Fighting, yes.
I'm not sure about that.
Oh, you're not sure about that. Okay, okay. Okay. Does she look a little bit puffy?
I think no.
No.
She always seems like sluggish, sleepy, excessive.
And then does she looks like easily cold lately for few months, I guess?
Maybe.
Is it
Maybe.
cold? You
I
are not
think.
sure.
I'm not sure.
Oh, you're not so sure if your daughter has. Oh, okay.
Uh-uh.
Okay, fine. Since she actually have the Down syndrome, may I know when the diagnosis of Down syndrome is made?
She was diagnosed with Down syndrome after birth because of the presence of syndromic features.
So does she have any symptoms during after birth? After birth, have directly have any symptoms or problems?
Symptoms such as?
Maybe she have difficulty to breathe.
Oh,
and then looks blue, kind of
Oh
blue.
yeah, actually after she had birth, she actually been admitted to an ICU and for 9 days for monitoring. Then the doctor said that she actually have structural heart disease. And if I'm not mistaken, the doctor said that she had VSD, the ventricular septal defect.
Oh, okay, VSD, okay.
After what investigation? Echocardiogram. So after the echo, the doctor said she had VSD. Then the doctor said she had to undergo operation because she seemed to have symptom of respiratory distress. So yeah, so she had operated. She had undergo operation. Yes.
May I know when the operation being done?
As soon as after the doctor noticed of the symptom of respiratory distress. After 9 days of birth.
After 9 days, okay. Okay. So other than surgery, is there any other treatment given? Maybe medication that you might know?
I'm not sure.
You're not sure, okay.
But the doctor asked for went for checkup to make sure that she doesn't have other complication from the operation.
So okay. May I know how frequent the checkup follow-up is? Once a month. Okay, okay. Does she have any, since after the surgery or after the operation, does she have any symptoms of heart failure?
Alhamdulillah, no.
No. May I know, do you see for your perspective, do you think your daughter is actually have her development is good for now?
I think she quite have development because she just started to crawl.
I'm sorry, I can't hear you.
Oh, I think she had a delayed development because she just started to crawl at 2 years old.
Oh, okay, okay. Is there any problem with her feeding? Is she breastfed before?
Yes, but only for a week. Then
okay.
Yeah, because she cannot suck much.
Oh, okay. And then start on bottle, right? After for 1 week, breastfed, and then start bottle feeding. may I know is she still feeding on formula milk right now?
Yes.
Okay, until now. Does she already start to eat soft food?
Sometimes.
May I know before your may I know on your birth history during your pregnancy, does you have any diabetes mellitus or hypertension?
No, I didn't have any.
Oh, you don't have. Okay. And then during how do you deliver your daughter? Is it normal delivery?
Normal delivery.
Normal delivery. And then your daughter just
Pardon?
okay. Okay, sorry. Other than for VST operation, does your daughter have any other event after birth, like jaundice, maybe? No.
No, she doesn't have any jaundice event, but she had to go to annual checkup to check for her eyes, her ears, because Down syndrome might have these complications, right?
Yes.
So for her eyes, and she doesn't have any congenital cataract, but she went for ophthalmic assessment, and the person said that she had reduced visual acuity.
What?
Reduced in visual acuity. Okay.
Okay. So what about her hearing? Is it okay?
We also went for the allergy screening, but the doctor said that she had bilateral hearing loss. However, I didn't notice any ear discharge, but I do notice that she rarely responds to my call. So, and the doctor said that it is due to otitis media.
Oh, I see.
However, we not plan yet to insert the grommet or something for the otitis media.
Oh, I see. Does she actually have frequent hospitalization for other reason?
Last 2 months, she had been hospitalized due to pneumonia, I guess.
Okay.
And I think she's been warded for 2 days.
For 2 days. She was presented with cough.
Yes.
Okay. Other than that, is there any other reason that you go to other hospitalization history? No. Apart from pneumonia.
No, I think that only the last hospitalization.
So you said that you have a regular follow-up, right? So may I know, does the doctor say that your daughter have kind of delayed development?
Yes, she have development and also intellectual delay.
Okay. So may I know, does she already take all of her immunization by according?
Yeah.
Okay.
She already did all the vaccines, and plus the doctor also suggests to take additional vaccines such as influenza and pneumococcal, as Down syndrome tend to have infection often, right?
Okay. And then may I know, does your daughter have a good social interaction with you?
With her brothers and me, okay, but other people not so good.
Okay. So she have other 2 brothers, or may I know how many siblings she have?
Oh, she had 4. She's the youngest.
4 siblings. She's the 4th one.
Yes.
So
for now.
For now, okay. So the first child? Is it boy or girl?
All three above her is all boys.
So all of them, the three of them doesn't have the same presentation as her. Okay, all of them is healthy. There's okay. The first one already go to school, or may I know the age?
First one is 13.
Oh, 13. Okay. Madam, I'm so sorry. This is quite. I have to ask this question. May I know the age? Your age?
Oh, right now.
Yes.
Or during.
Your age now, and then your age during your daughter. Your daughter is being born. Yes.
At that time I was 40, so now 42.
I'm sorry, I can't hear you.
At the time, 40 years old. Right now, 42.
Oh, at that time is 40 years old. Your husband?
45.
Oh, your husband is 45. Does your family have any history, does any of your family have Down syndrome too? Or this is first time?
This is the first time.
This is. Are you, both of you and your husband is working?
Yes.
So your daughter is being taken care by your sister?
My sister.
Oh, your sister. Does she check for oral hygiene? I mean, dental checkup.
Oh, actually, she also had dental problem. We already went for 2 times for dental problem. Initially, she was having toothache, and then last 2 weeks she have gum swelling and also discharge. So, and the dentist said that she had multiple caries. So we already done the dental caries clearance already. Did you hear?
Yes. Do you know what investigation being done to diagnose your daughter with Down syndrome that you are aware of?
I know it's like blood test for thyroid function. Then a lot of tests lah. I remember that the doctor had done. One of it is blood test, liver function, and also check for glucose because doctor scared that she might have seizure like that.
Okay. You said your daughter already started to eat soft food, isn't it? Okay. So is it the constipation started around after she just started eating soft food, or already before this already have this kind of presentation?
I noticed, and also my sister told me that when she started to consume the soft food, she had
Oh.
reduced
Oh.
bowel.
Okay. So when she started eat soft food, and then she already presented with constipation. If she just only take bottle feed, for example, there is no constipation, I assume.
Yes.
Oh, I see. Okay. Does she have I'm sorry. Is she taking enough fiber and water daily?
I'm not sure about that because she stay with my sister, right? But as I said before, she had a few passing house 2 episodes. So we also go to the pharmacy to buy the medication to soften her stool like that.
Oh.
But,
Oh, you but you don't you can't remember the name of the medication?
Yeah, I'm not remember.
Okay. So after giving the medication, is it resolved?
Resolved, but then
occur
yeah.
again. Okay.
So that's my baby. She tend to be more sleepy, have correlation.
Huh?
That's my baby condition. She tend to be more sleepy, like easily fatigue, have correlation to her disease right now.
I think so. I'm thinking of um she might have hypothyroidism, so might be, but I'm not one of my differential.
But I still remember her thyroid function test since she newborn was normal.
Yeah, the renewal is normal. And then during other checkup, is
Annually,
there
I need to do the test.
what?
The thyroid function test need to do annually.
Yes.
And last year during her at 1 year old, she also has normal value for thyroid function test.
Okay.
1 minute.
May I know, where do you live? I mean, what kind of house? Is it with good facilities?
Double story house.
Is it her brothers, her 3 brothers is interacting well with her, does not ashamed of her of something? Can bring friends to your home?
Alhamdulillah, they communicate together okay.
So do you actually really have nothing that you concern about your daughter regarding Down syndrome?
Of course, I'm concerned about her development.
Anything? Okay. Is it your current team that helping your daughter is already explained to you all the plan that they are planning for your daughter to treat your daughter?
Pardon?
I mean, do you aware the plan, or does your doctor explain what they are planning to do every follow-up?
Yeah.
So you're
Okay, thank you. Dr. Amira, can you make summary?
Summary. Okay. This 2-year-old baby with underlying Down syndrome presented to the hospital due to passing of hard stool for 5 days. The baby developed lethargy and being less active as well as sleepy lately. But there is loss of appetite, and she had underlying ventricular septal defect.
Okay, so I need everyone to ask now Noor Al-Aini one question about the global diagnosis. We have now a lot of points: Down, congenital heart, constipation, delayment, okay, and the other. So we'll be the first one to ask Aina. So the mom will be first one. Is that it?
Asked about the clinical presentation.
Okay.
Oh.
So what is the clinical presentation of Down syndrome?
Broad flat.
No, it is for Aina, not for you.
Oh.
What is the presentation of Down syndrome? How can you say? Yeah.
Presentation of Down syndrome. The patient will have broad flat face, and then usually have congenital heart disease, and then patient have epicantic I4, and then short nose and flat bridges, 1/3 of the eyes, and then he also have single palmar crease and have sandal toe gap at the toes. The patient might also appear to be weak, kind of hypotonia.
Okay, so Shohada, can you ask Aina one question regarding Down and its complication and its presentation?
I have a question. How does Down syndrome is related to endocrine complication, like hypothyroidism? How can Down syndrome cause hypothyroidism?
Who can answer? Okay.
I try.
Yes, ma'am.
If I'm not mistaken, Down syndrome are the common population to develop autoimmune hypothyroidism. Acquired hypothyroidism.
What type of hypothyroidism do you know? Primary or secondary? This?
I think it's primary.
Yes, Amir?
Is it primary hypothyroidism?
Due to dysgenesis or absent or what?
Of the thyroid gland.
Dysgenesis of the thyroid gland. Any other endocrinal problem? So you need, this is an important question, you must answer it, please. Okay, so there is a lot of endocrinal problem will happen with Down syndrome, from obesity, from other, and they can end also by Alzheimer. There is a lot. So who can, what other complication of Down syndrome? Because
delayed puberty.
Delayed puberty, before delayed puberty, there is global
developmental delay.
Okay, delayed puberty, and remember that the male with Down syndrome usually sterile.
Infertility.
Yes, but the female is not. Okay, she still can conceive. You must answer why. Okay, this is an important point. Also, the other complication.
Hearing impairment.
Sorry?
Hearing impairment.
Renal.
Hearing.
Hearing, yes. What type of hearing impairment? Thank you, Amira. So what type of hearing impairment?
Sensory neural deafness.
Any other answer?
Otitis media.
It is both.
Secretory otitis media.
It's both. It's both. Susceptible for infection, for chronic otitis media. It causes obstructive. Also, the nerve can be affected and cause sensory neural. So take care. It is double kick. Why? Because of the short neck and the anatomy is susceptible for that. What other complication?
Risk of dementia.
Dementia, okay. What else?
Recurrent respiratory infection.
So recurrent infection because he is considered like relative immune compromised. What else? Very common, not common, very dangerous to forget it. Down syndrome is linked with one of malignancy. What type?
Leukemia.
Leukemia.
Any type the patient is
acute myelodysplastic leukemia.
Yeah, that is very important not to forget it, because sometimes the patient just come with recurrent infection as we suspect. So you must add the blood film or make complete blood count to see the blast cell. It is very important. And even upon delivery now, they can do some study about the white count and the monocyte, and they can predict if this patient is susceptible for leukemia or not. So it is very important for a very common case like this to know the complication, okay? From the heart, from the chest, from the even persistent pulmonary hypertension, from the abdomen, okay, from duodenal atresia, from a lot of abnormality, Hirschsprung disease, which can this patient presented with it, or hypothyroidism, or endocrinal, or gross hormone deficiency, or short stature. So it is very, very common problem, and it is an important example of the importance of putting what is this program for follow-up. If you are very meticulous with time, you will say, I need to see the patient with Down syndrome like every 3 months. But at the end of 1 year, I need to check like thyroid function. And at the end of this year, I need to make every time to see the development, okay? And blah, blah, blah. So you will not miss any problem, okay? Another question, what is the percentages of congenital heart disease in Down syndrome?
%45.
How much?
45.
45, okay. It is between 40 and 50. So an important question will be asked. This patient with Down syndrome already delivered. It is clinically looks like Down syndrome. We are waiting for the karyotyping now. Should we did echo or not?
Yes.
Yes, Aina. You will do echo?
May I know the question? Repeat the question again.
Baby with Down syndrome delivered. We cannot hear any murmur. Should we do echo?
Yes.
I'm not sure.
Good. If you don't sure, said I'm not sure. It is good. It is better than. So anyone have an idea? Yes, Hasif. If you have the congenital heart disease about 50%, so it is wisely to do. Because not all congenital heart presented with murmur early. Even the most common congenital heart, which is the VSD, sometimes it may appear very late until the end of the first year, because it depends on the compensation between the both sides of the heart. Okay, so it is very important to consider echo for any patient with Down syndrome. One more question for you, Aina. What is the most important question you will ask Zati about her baby?
Sorry, lagging. What is it question? Sorry, doctor.
The most important question you will ask the mother.
Most important question.
Yes. Noor Fatiha, what did you suspect the most important question to be?
Most important question to forward answer.
Sorry?
The most important question for the mother.
Yes.
Regarding the Down syndrome.
Yes.
Maybe about social.
Social is important, yes. What else? Who can guess? If you saw a lady which is just 20 years with Down syndrome, what did you suspect it can be? If you are doing a karyotyping now.
Genetic.
There's family history of Down syndrome.
Sorry?
Family history.
I cannot hear you.
Family history.
Another one can tell what she said?
Family history.
Family history.
Family history. No, the most important is the maternal age.
Oh,
Why?
maternal age, yes. Because in this junctional, the probability of getting Down syndrome increases with high maternal age.
But if young lady got, so we must suspect.
Lifestyle.
So this will bring another question. If you did chromosomal analysis, how many types of Down syndrome you will find in the chromosomal analysis?
Three.
Three.
Three
First one
types.
is okay.
Translocation.
Translocation.
Mosaicism.
Yes, and if you go for translocation, you will find it is 1421, but some translocation like 2121, it may be got 100% Down syndrome. So it is very important. If you found a young lady and she said, I got Down syndrome, you must be very careful. Most probably you will ask
Translocation.
for the maternal, and sometimes you need to ask
Paternal.
for paternal chromosomal analysis. Because our rule to answer the question, any mother will tell you, oh, the next baby will be Down also or not. It's very important to get enough idea. How can we diagnose now the Down syndrome? We said number one, clinical. Number two,
Investigation.
Karyotyping.
Karyotyping, okay. Any other, if the mother came to you, she is pregnant.
Ultrasound.
Okay,
Ultrasound. Chorionic villus sampling.
Okay, what else?
Amniocentesis.
Okay, what else? Okay, let me share with you. This is an important lab, GMA lab. They are speaking, I think, I don't know if you can see this one or not. How to make it bigger? Should I change the presentation? Speaker view. Can you see this one now?
Yes.
Okay, this speak about very important microarray. Now it is very important because there is some chromosomal analysis which you can put in the number, so you can diagnose only the straightforward cases like Down syndrome, like Edward, like that, like Turner. But the most important microarray, it will speak to you about the like fish, about any translocation. So it is very important. Okay. So you must try to get some idea about the microarray chromosomal analysis. Another one, which is very important now, and I appreciate it in spite it is a bit costly, but known as NICC. This one, NICC. So it is abbreviation of non-invasive chromosomal analysis. I will read. It is a simple, safe, accurate, okay, chromosomal analysis which screen for a common trisomy, microdeletion syndrome, and 6 chromosomal anomalies as early as 10 weeks of pregnancy. How? This just by collecting a sample from the mother at the 10th weeks of pregnancy, we'll find some of the baby's blood inside the maternal. It will be few cells. They are now able to centrifuge and separate the baby's few cells, and then they are doing a chromosomal analysis for it. No need for chorionic villi, no need for amniocentesis, no need for a lot of invasive one. And it will be very accurate, really. It is a bit expensive, but this gives us an idea. Your responsibility is not enough to be a good doctor, but your responsibility is to be able to think about the future. Our brain is evolving. When now you are going to be graduated soon, but after 10 years, you will find the medicine is completely changing. That is the era. You must be a part of this, please, advancement. If we stay like that and we need only our self to be just following them, the other, it is not good. Okay? So here is, don't forget to read about microarray. Can you read it or not?
Yes.
Microarray, and here is some comparison about the two types. Okay? And this one in ICC is the test of choice for your non-invasive perinatal diagnosis. Very, very, very good, very accurate. There's a lot of details in this DNA lab. Most of the advancement of medicine looks for us before looks like dream, but now we are doing it. So please, put in your future to be interested in research, interested in thinking how to make things more applicable, and dream. And inshallah, you will find your dream in the actual life. Okay? Who will present the OSCE?
Me.
Okay. Go
Doc-
ahead.
Doctor,
Yes.
may I ask one question? Does the patient, this patient can actually cause, the constipation actually caused by Hirschsprung disease?
Yeah, that's why if we come to the investigation, it will guide us. Thyroid function test is an important to rule out a common problem, which is hypothyroidism and which occur around this age. The most important, we are susceptible for Hirschsprung, but usually it will occur a bit earlier, but we must suspect, is there any behavioral disturbance leading to the feeling of constipation? Is there any problem about the diet? Okay. What about his activities? Because any one of us, even like this movement to control order, a lot of persons are complaining that they feeling like constipation because of less activity. Okay. So sometimes he got like anal fissure, and this Down syndrome usually is afraid. So he refused to do toilet, and it will be a vicious circle. So it is a lot of detail, okay? But you must be very comprehensive in suspecting the cause. So dietary history, is there any pain with defecation before? So it make him like anal fissure. What about his other symptoms of hypothyroidism? Is it there or not? What about the abdominal distension? What about a lot of cases must be ruled out. Even for normal child, if he came and complaining of constipation, it may be very simple, and sometimes it needs you to have a high index of suspicious. Okay? Okay, let us go for OSCE, inshallah, within 10 minutes.
Okay, so the first question is describe the syndromic features seen in the illustration as we discussed before. But we can see more details on based on the illustration.
Who will answer?
Slanting eye.
The first features is brush field spot.
Okay.
Broad flat face.
Epicantic eyeball.
Get the eye for okay.
Short nose.
Short nose.
Short neck.
Protrude tongue.
Okay, so here is
What else?
Low set ears.
Okay.
Flat
another
nasal
one.
bridge.
Rounded face.
A flat occiput.
Short neck.
So thank you for that slide. It is very important for us because you may see the patient with Down syndrome and you can swear it's Down. Okay? But the ability is not to make spot diagnosis. The ability is to able to describe everything. And please be systematized. If I asked you, sometimes I will ask if this patient has Down syndrome or not. Or the mother feels that her baby looks strange, he looks like Down syndrome. Did you agree with the mom or not? Okay? So you must be able to get it part by part. Okay, so you can go now for the second slide, please. No, the same one if your colleague doesn't show it. So this is flat, the back of the head, okay, which is the same one. If you did ultrasound, they will tell you there is nuchal lucency. It is the same. This is abnormality of the eye. You must comment by that for the nose. So you must start by part. Please don't miss and don't go for face and then hand and face and then hand like that. So try to finish everything. If you are going to speak about hand, we will speak about the palmar crease, about the shape of the fingers, about the lobes, all this about the shape of the hand, which is short and broad. It is very important. Okay, this picture, I think you can study it hardly, please. Okay. Next one. Who can answer?
Sandal gap between big toe and second toe.
Okay, what else? What you can see from the position of the child.
Hypotonia.
Yes, it is very important. They are very famous for hypotonia, even if it is looks like relaxed. He is dependent on his hand. His leg is widely separated. Okay, so it is very important. What else you can see other than facial feature?
Clinodactyly.
Okay, abnormal. Okay. He is a bit obese, yes?
Yes.
Why? So you must ask yourself about that because it may be a sign of hypothyroidism. If you start to gain weight and feel cold and got constipation, like our patient, we must suspect it can be
hypothyroidism.
hypothyroidism. Okay, his hair also is very, very pale, and his eye is good. If this baby is not slanting and like that, doesn't look like Down syndrome, I will consider him like phenylketonuria, okay, which is mentally retarded with a very nice hair and eyes. You must get an idea about that. Thank you for these percentages of characteristic, but I didn't prefer to say mental retardation. I don't know. Now they are trying to use a soft touch words, because if you tell the family, your baby, your child has mental retardation many times, sometimes you will feel trauma. So the best is said like it is school backward, okay, intellectual problem, like that, okay. And even now, if the patient has like cancer or like that, we prefer to say it is proliferative disease, because the patient has a cancer already. No need to tell him 100 times when you speak to him 100 times cancer, cancer. So they try to put now some words which is soft for the patient, like proliferative disease, instead of said dysmorphic features, which is looks like an impact. Okay, he will say that's abnormal facial features. Okay, so please remember that your responsibility during practice medicine is to go through the order of Allah. وَقُولُوا لِلنَّاسِ حُسْنًا. Select your words. It has an impact on others. And if you said a good word, Allah will give you a good offer. So it is very important, please. Okay. Thank you also for this slide. Next one, I think macroglossia must be revised. Is it macroglossia really? Down syndrome, as I know, has normal tongue but small mouth. Yani his tongue is normal size, but the mouth is small. So the tongue will be protruded and fissured, which you call scrotal tongue, like that, because of its fissures and exposed. Just we need to revise this one, picture by Muhammad Rafiq. Okay, next one, please. Yeah. Thank you. Who can describe?
Umbilical hernia.
Yes. What else?
Distended abdomen.
Distended abdomen.
Okay, what else?
Hypotonic posture.
What else?
Kind of scaly skin.
Sorry?
Scaly skin.
Not like that. Okay. What about the face? Go up, go up.
Myxedema.
Myxedema.
Myxedema, dull face, protruded tongue, slightly obese with hernia. All this is an abnormality with congenital hypothyroidism. But what is the most common presentation? No, the most common presentation of early is asymptomatic. Okay, that's why we must do screening for every patient as to diagnose the hypothyroidism earlier. Otherwise, if you didn't treat within the first 2 to 3 months, the patient will be mentally retarded. Okay? Did you understand that one? Okay, thank you. Very good table also. This is the down, this is the hypothyroidism. Yes, what is this one? Yes, atlantoaxial instability. Why it is very important? Because if you need to intubate any patient with Down syndrome, take care, don't put pressure on it. You can kill the patient by that maneuver if you didn't aware about that. Okay? Very good.
Doctor, we cannot hear your voice.
Thank you for your good job about OSCE. You have 1 minute to ask any question if you need, but I hope that you can please go for a study deep and try to imagine the patient and how you can come for the full diagnosis and the expectation now, what is the problem may be met by the patient is very important. Okay? Any question? Okay, that's good. Hoping inshallah see you again as I have another session after minutes. Okay. Thank you.
All right.
And see you again. Okay.
See you again, doctor.
Don't forget to share this one with our science officers, Farah or Hidayah. Thank you. Inshallah, hoping to see you again soon.
Thank you, doctor.
Thank you, doctor.
Okay, doctor.
Assalamualaikum.
Waalaikumsalam.
Amir, kenapa kau buat hantu ni?
Aku sengsara gila.
Apa?
But
Penat. Zati berapa annoyingnya.
Tati nak tanya, facial cream hypothyroidism ke face
Yep. Dia acquired hypo.
dia
Acquired
Sebab dia
hypo.
waktu screening tak ada kan, normal kan.
Awal tak ada kan?
So dia bukan
Kenapa
congenital
Syafra?
hypo.
Tapi dia bukan duodenal atresia lah.
Kan. Duodenal
Dia
atresia.
boleh dia boleh
Boleh,
berak kan.
Boleh.
Boleh.
Tapi dah 2 tahun dia dah
Tu lah. Yang tu macam awal-awal kan.
tak awal-awal biasanya dia orang muntah lepas tu dia orang feeding. Lepas tu tak berak.
True. Tak berak. Ni berak kan tapi
Tak.
true.
Macam ni kan aku tanya kau tadi kan dia aku tanya tak aku cakap kau confirm je sebab aku cakap confuse je tadi. Kan tadi aku tanya kau after dia kan adakah baby kau ni dia dapat constipation after dia start weaning ataupun bottle feeding dia dah ada constipation. Kau kata after start weaning.
Kesian Aina nak keluar Zati.
Kan kalau bukan kalau constipation yang start after weaning bukan Hirschsprung disease common kalau Hirschsprung disease.
Tak tahulah. Hirschsprung yang aku tahu dia early diagnosed. Macam after birth tu dah tahu ada. Tak tahu lah.
Macam mana nak diagnose early tu? Apa je lah.
Early apa?
Tak apa je lah. Hirschsprung tu macam mana nak tahu? Yang awal-awal nak diagnose tu?
Yang tak boleh nak pass meconium tu within 24 to 48 hours.
Aku rasa doktor ada.
Tapi aku tak tahu sangat. Kan history aku reka.
Ya tak apa. Okay, thank you korang.
Thank you semua.
Aku tak makan lagi.
Thank you semua. Bye.
Bye.
Okay, bye.
Bye.
Annyeong.
Annyeong, makan.
Assalamualaikum.
Waalaikumsalam.
Jangan lupa solat azhar Isyak.
Ada ingat lah solat dia.
Isu jamak dia.
Bye-bye.
Bye.